Assalamu alaikum. It is Mubaraka. How are you guys today? So today, number one, let me say, I miss you guys. I have not come on live for a couple of days because life has just been crazy. But I was like, I miss my people. I miss my tribe. I have to go and talk to them, and I have to go live today. No matter what, we are going live today. Okay, so it has been a very busy week, and I wanted to come live and give salams. Assalamu alaikum. And I also wanted to talk about something that keeps coming up. So you guys probably know, if you've been on my stories or on my IG, is I have been doing a Wellness Wednesday over in Clubhouse, both inside of the Village Auntie Club, inside of the Muslims Club. Join me next week. I will be there as well. The information will be inside of my stories. But what is constantly coming up inside of conversations is PCOS. So I thought that I would come on today and talk a little bit about PCOS in particular, and diet and exercise for it, because a lot of women struggle with PCOS. And in that way, it is here on the videos, and people can share it and watch it. All right. So tell me where you are joining me from. I love to know where you are and how you're doing it, and how you're doing today. So here in Connecticut, it is snowing pretty hard. It's only been snowing for a couple of hours, and we probably got, I don't know, a half a foot of snow already. It's crazy. All right. So, how are you guys doing? Yes, I can, Kelly. I will write a note to myself. Do a video on inflammation. I'm writing a note to myself literally right now. Hey, Honey ZF from Canada, and Kelly from Saudi Arabia, and Bint Mansour from Chicago. Assalamu alaikum. Samra, good. The weather in Pakistan is getting decent. Does that mean the cold is going away? Because our cold has just started. Nikki from Florida. Chai City Teas from Chicago. Awesome. I see DMV, the Sweets, SU, I think. Nigeria, UK, San Antonio, Texas. I love the internet. Right? I love the internet because it brings us close together no matter where we are. I'm sorry, I'm getting rid of my notifications. Excuse my hand. Okay, so today we are going to talk about PCOS, and we're going to talk about PCOS because it is super important. That's number one. Number two, I have been talking about it a lot lately, and I think that it escapes me sometimes how common it's being diagnosed and how many women struggle and not sure what to do about the struggle of PCOS, right? Once women are diagnosed with PCOS, they feel as if like, okay, this is an uphill battle that I'm not going to be able to win. So I have good news for you. You can win it, and I'm going to tell you how. So if you have never joined me before, my name is Mubaraka Ibrahim, and I am your health and happiness coach because you're here. And if you believe that physical, mental, and spiritual well-being is intertwined, and the weakness of one weakens them all, and the strengthening of one strengthens them all, then welcome. You have found your tribe, and we want to welcome you to the tribe. We talk about food, faith, and fitness here on the Fit Muslimah platform, and I am happy that you have joined us. So make sure you share this video and you tag a friend, because we talk about everything several times a week. And I'm always looking for suggestions as well. If there's something particular you want to talk about, just slide into my DMs and say, hey, here's a topic that I think is important, and maybe we'll talk about it. All right? So, PCOS. Polycystic ovarian syndrome. That is what the acronym stands for. Polycystic ovarian syndrome. PCOS is not a disease. So I think you need to definitely understand that. It is not a disease. If you're diagnosed with PCOS, it's not as if it is a disease that is a chronic disease that you're never ever going to get rid of. Definitely not true. PCOS is a collection of symptoms. So your doctor is looking for certain symptoms, and if you have 3 or more of them, he or she might diagnose you with PCOS. So, what are those symptoms? Male pattern excessive hair growth. So if you are a woman and you are beginning to grow hair on your chest, hair on your back, hair on your chin, hair on your mustache, hair on your buttocks, all of those are considered male pattern hair growth. It is a place that women do not normally grow thick areas of hair. And so if you have this pattern of hair growth, that is a symptom. Let me also precursor this by saying that you may or may not have PCOS, and you should consult your doctor if you have these symptoms. I am not a physician. I am a health coach. So male pattern excessive hair growth, irregular periods. If you have had irregular periods for several years, also very harsh periods, and that can be from several things, as we know as women, but that's one of the signs that they look for. Weight gain, right? When you're gaining weight, unexplained weight gain in particular, and having a very hard time losing weight is something else that they look for. Thinning hair, right? So again, male pattern thinning hair, maybe hair here, right? Beginning to thin out. Acne. Insulin resistance, right? You've been diagnosed with prediabetes or diabetes, fertility problems, and yes, cystic ovaries. Cystic ovaries is actually only one of so it's called polycystic ovarian syndrome. And many people think that the doctors start off with, hey, you have cysts growing in your ovaries, so you must have PCOS. That's actually not really true. You have to have several symptoms along with it, because women's bodies are very different and vary throughout our cycle of reproduction. And so we may start off with small cysts in our ovaries. We may end our reproductive cycle with small cysts in our ovaries. So that's actually not the main thing that doctors are looking for, that you have cysts in your ovaries, but it is one. Oftentimes people, they think, well, this is a problem. Oh, and of course, one of the biggest problems for many women is they also have a problem getting pregnant, have fertility issues, right? So when your doctor sees 3 or more of these symptoms, they may consider diagnosing you with PCOS. Again, PCOS is not a disease. It is a collection of symptoms. And so when you can get rid of one of these symptoms, or 2 of these symptoms, and you no longer have it, then you are no longer diagnosed with PCOS. Your PCOS is, for lack of a better term, cured, okay? One of the issues with women with PCOS, one of the kind of like main issues, let's talk about health and diet, is the insulin resistance. Let me mention a couple. Before we talk about diet and exercise, I want to mention a couple of things. Number one, when women have PCOS, oftentimes they have a collection of other symptoms that develop from the original symptoms, right? And so that can include your insulin resistance turning into diabetes, high cholesterol. Research has shown that women who have irregular periods for 4 or more years, who have PCOS, are at a higher risk for for ovarian cancer. So it's not like something that you can say, okay, I've been diagnosed with PCOS and all is lost and there's nothing that I'm going to do about it. You certainly should try to manage it and change your eating and your movement patterns so that you can get rid of it, because it can create other more serious health issues down the line, just like any other metabolic dysfunction. A couple of things. There has been no genetic link made for women with PCOS, blah, blah, blah. There's been no genetic link made with women with PCOS. So because you have it doesn't mean your daughter's going to get it, right? So they don't know what causes it. And they don't know whether or not it's a gene, if it's a lifestyle, right? They just look at these individual symptoms and they diagnose you with it. So one of the main issues with PCOS is the insulin resistance. The insulin resistance is an important part of the symptoms of PCOS, because that indeed creates additional problems like diabetes, leading to heart disease, leading to high blood pressure, so far and so on. So when it comes to diet and exercise, that is where the focus needs to be. The focus needs to be, if we can get the insulin resistance under control, if we can reverse the pre-diabetes, then we can begin to balance out the rest of the hormones. There was one study that was done at the University of Italy that was reported in the Journal of Translation Medicine. That's what it said, where the study first started off with looking at 24 women with PCOS. 8 of the women were disqualified, and then the rest of them went on to follow a ketogenic diet for 12 weeks. Within that 12 weeks, the women lost significant amount of weight, an average of 20 pounds in 12 weeks. They all lowered their lipid level. They balanced their hormones. So the researchers' words were they improved disordered hormones and lipids. So that's the researchers' words. And as well as 2 of the women actually had to drop out of the study because they, after years of having fertility problems, they actually got pregnant during the study. So this is a study that was done with the University of Italy. There are more studies, right? This is a small study, a small cohort. So researchers are actually looking at this as an area of interest of things that can help women with PCOS. When we talk about insulin resistance, in particular for women with PCOS, what I really, really want women with PCOS to understand is that the way that food affects other people is not the way that it affects you. You know my philosophy. There is no such thing as a universal food that's healthy. There's no such thing as a universal diet that everybody should follow. I, in particular, follow a ketogenic diet, but that may not be appropriate for some people. But the people who it is appropriate for, I teach them how to use it to balance their hormones and kickstart a healthy lifestyle. When we talk about PCOS in particular, because insulin resistance is one of the main markers that women with PCOS, one, it is an impetus for a diagnosis, and number 2, it is something that when you have PCOS can actually begin to get worse, right? It goes from being insulin resistant, pre-diabetic, to you actually having full-fledged diabetes, and so on and so forth. And if you do not eat and move in a way that can reverse and that can cure that, then it leads to other health issues. For women who are insulin resistant, and what is insulin resistance? So I'm going to go over this really quickly because I think I've talked about this before in other videos, but that's okay. It might be your first time joining me. Let's go for it. Insulin resistance. What is insulin? Insulin is a hormone. Insulin is a hormone, and its job is to open up the cells to allow nutrients into the cell. That is insulin's job. Most people eat glucose. Carbohydrates turn into glucose. Glucose is sugar in the blood, right? The glucose comes into the body, and glucose is not it's not a nutrient. It is like a transport vehicle, right? Your nutrients attach itself into glucose. The cell has to open. It's like the car. It's like the delivery truck. Hey, let's call it Amazon, okay? Glucose is the Amazon truck. All your nutrients, when you eat carbohydrates, is attached to glucose. Insulin opens up the door. That's you. Hey, my Amazon delivery is here, right? Insulin opens up the door to allow the nutrients inside of the cell. Insulin resistance is when you're not home and you don't get your packages. Okay? So, insulin resistance is when your cells do not open in the way that they need to in order to absorb the nutrients that's coming in with the glucose, right? So that's insulin resistance. And that happens oftentimes after years and years of getting too many packages. And the hubby now says, all right, that's enough. You're spending too much money on Amazon, right? So years and years of getting those packages. And then insulin resistance is when the cells just do not open, all right? The cells they just stop opening the door. Husband is like, nah, ain't no more coming in. Close the door. Okay? And so that's insulin resistance. So how does it interpret in different individuals? When you have insulin resistance, and I'm going to don't use these numbers as the actual number. Again, I'm just trying to say it in a way in which you can relate to. A person with insulin resistance versus a person that does not have insulin resistance. So let's say both of them eat, I don't know, a banana, right? The person who has insulin resistance, you have 30 grams of carbohydrates coming into your system when you're eating a banana. If you have insulin resistance, when the carbs get to the door, when the packages get to the door, your insulin level can rise, say, let's just use 100 as the marker, right? Insulin level rise to 100. Person without insulin resistance, insulin level rise to 100. When you have insulin resistance, what happens is all of those packages get stuck at the door and it stays 100 for a long period of time. Whereas the person without insulin resistance, it goes up and it comes right back down to normal, right? When you have insulin resistance, it is resisting getting inside of the door and it's staying there, and that is where the problem happens. When you look at sugar on a microscope, it actually looks like little spikes. The blood sugar, let me say that again. When you look at blood sugar, glucose in particular, on a microscope, it actually looks like little spikes. This is the reason why when people have diabetes, or unmanaged diabetes, I should say, the first thing that they start having problem with is their vision, because the veins inside of your eyes are really small. And so the spikes can actually damage the smallest veins first. And so that's why the first thing that happens when people have unmanaged diabetes generally is they start developing glaucoma, they start developing problems with their eyesight, because now you have so many of those spikes in your blood system all of the time. It is damaging the smallest vessels first. So that's just a little interesting side note and fact. So how do we eat in a way that is going to lower insulin level? Now, you probably saw this coming. You know you got to cut out the carbs, right? You're going to cut out the carbs because your insulin does not allow it to come down as quickly as somebody who does not have insulin resistance. We like to think like, oh, everybody can eat the same way as long as we do stuff in moderation. Moderation is for you to maintain health. It is not for you to cure a metabolic dysfunction or a disease, right? If you were allergic to peanuts, you wouldn't say, oh, let's just eat them in moderation. Because even in moderation, it will give you anaphylactic shock, right? We have to think of diabetes, obesity, just like we think of every other disease. Our goal is not to, if you had cancer, you don't want to moderately get it down. You want to get rid of it, right? So every dysfunction of your body, your goal should be to get rid of it. When it comes to insulin resistance, we want to get rid of it as soon as possible. And the way that we do that is by cutting out carbohydrates. You have to significantly reduce your carbohydrates because your body does not respond the same way as somebody who does not have insulin resistance. This is about eating for your health. And again, and I will say this probably over and over again, there is no universal healthy food. You should eat according to your health and your goals. So if one person has PCOS, and the other person has Crohn's disease, those are two completely different things that you're trying to cure. And so you should eat accordingly. If one person's goal is, hey, I need to lose 50 pounds, and the next person's goal is, hey, I want to run a marathon, you're eating differently. So don't go by what other people are eating. And this is really common, especially on social media. And I get this a lot. Can you show me exactly what you're eating so that you can eat like me, but you don't move like me? Your lifestyle is different than mine. Your health is different than mine. So you shouldn't be eating exactly the same thing that I'm eating. You have to eat according to your personal goals. And there is no such thing as a universal healthy food. Tomatoes are great. They're full of vitamin C. They're full of antioxidant, which is a lycopene, which is a superstar. But if you have acid reflux, then you probably shouldn't be eating tomatoes. Honey is a very nutritious food. It has over 110 vitamins, minerals, and electrolytes. But if you have PCOS, if you have diabetes, you should not be eating honey. I can eat honey. I mean, I rarely do, but I can eat honey and I can be fine, but I don't have insulin resistance. If I gave honey to somebody with diabetes, it could put them in a diabetic coma. There is no such thing as a universal healthy food. You have to eat according to your health. Okay, with that said, I know I am missing some questions. I saw some questions over here. Yes, this is going to be saved on my profile. Can PCOS also lead to the first early onsets of menstrual cycle? No, they are two completely different things. If you have a child that is diagnosed with PCOS, that's a completely different issue, meaning like PCOS did not cause your child to get their period early. If your child has not gotten their period, then they probably won't be diagnosed with PCOS because the polycystic ovarian syndrome is generally reserved as a diagnosis for women who have already started their reproductive cycle, meaning the beginning of the period on, all right? If you have a young person, right? So this is actually a diagnosis that I've actually seen girls who are 18, girls who are 22, and they're being diagnosed with PCOS. One of the bigger problems is the obesity rate, right? The obesity rate for women with PCOS, most women with PCOS are overweight or obese because that is actually a part of the symptoms of what makes the doctor want to diagnose them with PCOS. It is a common diagnosis. It is often misdiagnosed and overdiagnosed according to many researchers. But if you have the diagnosis, know that it is not the end all be all, and you can get rid of the symptoms. So let's talk. So we talked a little bit about PCOS when it comes to diet, low carb. You want to, if you're going to go low carb, it should be a well-formulated low carb diet, which means you should be getting your carbs from lots of vegetables. You should stay away from high glycemic fruits. You need to remove grains, yes, even whole grains from your diet, because remember, we're not trying to moderately get rid of a disease or a syndrome. We're trying to eliminate it. We're trying to get you back to normal. We're trying to restore homeostasis inside of your systems and your hormones. When the research that they did for women with PCOS, when they followed a ketogenic diet, at the end of 12 weeks, their hormones had balanced out, right? The other thing I think is a myth about PCOS in particular is people want to say, oh, well, it's a hormonal disorder. The hormones being disordered is a side note of the other symptoms. You aren't diagnosed with PCOS because your hormones are out of whack. Your hormones can be out of whack for several reasons. PCOS may or may not be one of them. So it is not a hormonal disorder. The hormone that they look for in PCOS is actually insulin and insulin resistance. That is the main thing that they're looking for. Yes, women with PCOS can have a higher than normal testosterone level, but that's actually not one of the things that they use to diagnose PCOS with, right? It is the symptoms that we talked about earlier. If you're just joining me, then we talked about the symptoms earlier. When we're done with the video, you can go back and you can watch it from the beginning when we talked about what is PCOS and what are the symptoms that doctors diagnose with it. Akila said, not all women who have PCOS is diabetic or insulin resistant. So what diet should they follow? Not all women with PCOS is diabetic, but a large majority of them are, and you are at risk for being pre-diabetic and having insulin resistant. So I would suggest the same thing. So we're talking 80 to 90% of women diagnosed with PCOS have insulin resistance. If you've been diagnosed with PCOS, your doctor probably put you on metformin because it's a really common drug that they use in order to treat it, because it's actually being treated, they're treating your insulin resistance. Honey said she was diagnosed with PCOS, but alhamdulillah, conceived. But her pregnancy was tough with hormonal support throughout pregnancy. Alhamdulillah, congratulations on your daughter. So it is not, so that's actually a good example of, it is not a fatalistic diagnosis, right? It is really, Lubna Powell, who is a fertility researcher at Yale, I did an interview with her, and she at the time was doing a research study about women with PCOS and vitamin D. And one of the things that she mentioned was that when women have PCOS, almost all of them have a low vitamin D level. And so their research was around whether or not what comes first, the cart or the horse, and whether or not they can improve it with vitamin D supplements. And so she was like, the researchers have to, what they want to research to find out is, having low vitamin D make you more prone to developing PCOS, or does PCOS actually cause low vitamin D? So that's another really interesting area of study that is actually going on now at Yale. So we talked about diet. We talked about low carb. So I want to mention this too, because a lot of people, when I say lower your carbs, they're like, well, what do I eat if I don't eat rice? What do I eat if I can't eat bread? So breakfast may look like 2 scrambled eggs made with olive oil and or an omelet, right? Made with olive oil, onions, mushrooms, peppers, cheese, All of those things put together inside of an omelet and a side of a half an avocado, right? Lunch may look like a taco salad. You may be having some ground beef or even ground soy. And actually don't use the TVP, which is processed. Actually use soft soy and, soft tofu, right? That's an option. With taco seasoning and lettuce, tomatoes, guacamole. You can tell I love avocados, right? Because it's the first thing that comes to my mind. With guacamole, and you can have all of that inside of a taco salad. And dinner may look like some grilled chicken with some greens or spinach or squash, right? That would be a complete day of eating a low-carb, well-formulated diet that includes lots of vegetables, that includes adequate amounts of protein and adequate amount of fat. So don't think that because you need to eliminate rice and bread that now you're not going to have anything to eat. There is a plethora of things to eat other than rice and bread. All right, let's talk real quick about exercise. What type of exercise? Exercise, just like food, can be medicine. And we know that certain exercises are more appropriate for one type of health problem than another. So the examples that I like to use is that we know that if you have insulin resistance, then resistance training, right? No correlation. Resistance training or weight training is actually the best thing that you can do because you need to build muscle. If you have, for example, high blood pressure, then you should be doing lots of cardio. Cardio is the exercise of choice. You need both in both situations, but when we talk about exercise specifically for insulin resistance, you want to make sure that you are trying to build muscle. Why is that? You want to build muscle because when you have glucose in your system, it's stored in three places. Well, it's in three places in the body, right? You eat a carbohydrate, it actually converts into glucose, which is sugar in your system, and it's in your blood, place one, right? Goes through your blood, it gets to your liver, the liver converts it to glycogen. Glycogen is glucose, the way that it is stored in the liver, right? Just think of like your liver repackaging it, right? Turns to glucose. The next place in which your glycogen is stored is inside of your muscles. That is the third place. When your liver is filled, your muscles is filled, then it is turned into fat cells. And that is technically the fourth place, but we're not going to include the fat cells, all right? Because we're going to get rid of those. One of the blood, liver, muscles. You cannot increase the amount of blood in your body so that you can dissipate the amount of glucose that's coming in, right? Can't really do that. You can't make your liver bigger so that it can absorb more of the glucose. But you can make your muscles bigger so that it can absorb more of the glucose out of your blood. All right? You can make your muscles bigger. That is the reason why resistance training and building muscles is absolutely essential if you have prediabetes, diabetes, or PCOS, right? Because you want your muscles to be like a sponge and absorb all of that glucose as much as it can out of your bloodstream so that it isn't damaging all those blood vessels and it isn't causing damage in the rest of the body. Our goal is to build more muscle so that it can be, so our goal when we have insulin resistance is to build more muscle so that it can serve as a sponge, all right? So that's why resistance training is important. What is resistance training? Resistance training does not always have to include you lifting up a physical dumbbell. Resistance training can be you just doing body weight squats. You can increase the intensity in terms of the speed, meaning that you can actually make a squat more intense by either going faster or going slower. That's one thing that a lot of people don't realize, that you don't have to turn a squat into a plyometric squat. If you slow it down, your muscles are under tension for a long period of time. And what do I mean by that? Do a squat and come down with a 10 count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take 10 whole seconds to go from a standing position to your squat position where your knees are at least 90-degree angle, or wherever your squat is, right? You will feel the difference. It makes a significant difference than you just going 1, 2, 1, 2, right? It makes a significant difference. So you don't have to always like, let me see if I can get 50 more squats in. Let me see if I can get 50 more squats. Slow it down, especially if you have knee problems or if you impact things, bother your joints. Slow it down and you will get just as an effective exercise as if you were doing it super fast, right? Because your muscles are under tension for a longer period of time. That is the way that you can build muscles, through resistance training. Resistance training is not running. It is not a Zumba class. It is not a step class. It is not going bike riding. All of that is cardiovascular exercise. Resistance training is lunges, push-ups, squats, dips, using weights, using a medicine ball, using a kettlebell, all of those things, all right? All of those things are types of resistance training. You should be doing resistance training 2 to 3 days a week, a minimum of 2 days a week, preferably 3 days a week. If you've never done it before, just start off with twice a week. What else? There was a question here. What about the studies that show women with PCOS should eliminate soy and soy products and dairy from their diet? I am going to refer you to go to, what is his website? Dr. William Lee. So I am not familiar with those studies, so I'll be honest. Like, I've never seen a study that said that women with PCOS need to eliminate dairy. Dr. William Lee is a researcher, and he has a, what is his website? His website is, I want to say eattobeat.com. And he talks about the misinterpretation of studies of women and soy and how it actually does not raise estrogen levels. And that was theoretical, but when they put it to an actual test in proper research, that soy was not a reason, does not create an an estrogen elevation. And it is not a source of concern for women. But he is an actual researcher, and he has lots of information on that. So you can, he has an Instagram presence. I'm not sure if he has a Facebook presence, but his name is Dr. William Lee. L-I is the last name. He did a TED Talks called Can We Starve Cancer? Highly recommend it. Go watch it. I actually send it out to all of my clients and tell them to go there. I'm trying to get him to come on and talk to you. So Dr. Lee, somebody tag him in Instagram. We want to talk to you. I'm trying to get him on to come and talk to you guys. So hopefully we'll tag him and put some pressure on him. My ladies want to talk to you. My tribe wants to talk to you, Dr. Lee. Does energy have anything to do with PCOS? Not necessarily. Your energy level can be related to your insulin level. When your insulin is really high, people feel very fatigued. Also, we talked about vitamin D, that it is really common for women with PCOS to have low levels of vitamin D. When you have low levels of vitamin D, fatigue is a key symptom. Fatigue is a key symptoms when you have low levels of vitamin D. So the vitamin D is, it could be a reason. So I would say get your vitamin D level checked. Obviously, you know, one of the common things is to get your iron checked, but a lot of people overlook the vitamin D. Super, super important. Thank you, Nick Get Fit, for tagging Dr. Lee. Everybody tag Dr. Lee. Tell him we want to talk to you. There's some social media pressure out there. I'm always talking about his research, his book, his TED Talk. So I would love to have the opportunity to interview him. All right, ladies and I guess probably a few gentlemen has joined us, right? So again, we talked about today diet and exercise related to polycystic ovarian syndrome. I want you to know that it is not a fatalistic diagnosis. It is not a disease. It is a collection of symptoms. Oftentimes, when you can decrease and get rid of insulin resistance, you can actually normalize your periods, balance out your hormones. Research has shown low carb diets and definitely doing resistance training as a part of that. We talked about the symptoms that doctors often use to diagnose somebody with PCOS, and the fact that if you can get rid of several of those symptoms, then you will no longer be diagnosed with PCOS. I want to take this opportunity to invite you to send me a DM. I have the 40-day challenge coming up, and we start on Sunday, so you only have a couple of days to get enrolled in that. And then I also have a more intimate pilot program that I am starting that you can actually go and send me a DM about that as well if you want information on that. But the important thing is the tips that I gave you, you can start doing that immediately. You can start reducing your sugar, reducing your carbohydrates, and starting, you know, eating a healthier lifestyle and moving more often. If you have a suggestion for a live, I've seen a couple of around this time, send me a DM so that way that I can save it. I can mark it inside of my DMs as suggestion for future lives. So today's Thursday, so that means I see you on Monday. Have an awesome weekend. Do something that is going to cause you to sweat and eat healthy. All right? Assalamu alaikum.